Hey guys, welcome to embryology series. Today topic of discussion is developmental anomalies of face. If you haven't watched my first video that is development of face, then please go and watch this video for the better understanding of this topic. Now developmental anomalies of face. Firstly, it consists of hair lip. Why so name called hair lip? Because hair which has a cleft in her upper lip. Okay. Then unilateral hair lip means failure of fusion of maxillary process with medial nasal process on one side. And bilateral hair lip means failure of fusion of both maxillary processes with medial nasal process. In unilateral, there is failure in only one side, while in bilateral, there is failure on both sides. You can see in the diagram of number C, that is unilateral hair lip, and in D there is a bilateral hair lip. Then midline cleft of upper lip. It is a defective development of lowermost part of frontonasal process which may give rise to midline defect of upper lip. That is, in the structure E there is midline hair lip. Then cleft of lower lip. Cleft in lower lip is due to defective fusion in mandibular process. You can show in the diagram F. It can also extend into the jaw. Further, there is a oblique facial cleft. In this anomaly, there is a non-fusion of maxillary process with lateral nasal process. I repeat, it is a lateral nasal process and not medial nasal process. Okay, so it give rise to cleft running from medial angle of eye to mouth. You can see in the diagram that is oblique cleft palate in the diagram A from eye to mouth. Then in this anomaly, nasolacrimal duct does not form. Then another defect is macrostomia and microstomia. Usually stomia means mouth and macro means bigger. So from this name you can conclude that macrostomia means bigger mouth, wide mouth. It occurs due to inadequate fusion of mandibular and maxillary process, while microstomia is due to the excessive fusion. Okay. Then other is proboscis. In this condition, nose may be a bifid, which is associated with median cleft lip. Both these occur due to a bifurcation of frontonasal process. Occasionally, one half of it may be absent. Very rarely, nose form a cylindrical projection. In the diagram, you can show a proboscis. This diagram showing there is a cylindrical projection known as proboscis and single median eye. Here, nose is absent. This is a congenital anomaly. Then here showing the macrostomia, bigger mouth, and microstomia and oblique cleft palate. Okay, then another anomaly may sometimes affect only the half of nose. Is usually associated with fusion of two eye. The fusion of two eye known as cyclops. Then mandibulofacial dysostosis or first R syndrome. It is a genetic condition inherited as autosomal dominant. In this occur, the entire first arch may remain underdeveloped on one or both sides, therefore affecting the lower eyelid, maxilla, mandible and external ear because the first pharyngeal arch may remain underdeveloped. So there is a prominence of cheek is absent and the ear may be displaced ventrally and caudally. There may be the presence of cleft palate and of faulty dentition. Then retrognathia means there is small mandible compared to the face. Retro means small and aganthia means absence of mandible. In this condition, the eye may be widely separated and widely separated eye known as hypertelorism. The nasal bridge is broad. This condition results from presence of excessive tissue in frontonasal process. Lip may show congenital pits or fistulae. Lip may be a double. Okay. And here we end the developmental anomalies of face, which is a clinical part mostly asked by examiner in viva and also in theory exam paper for development of face explained with clinical. Then you have to write all the anomalies, that is oblique cleft palate with macrostomia and microstomia, then proboscis and all. This is an important topic, guys, and thank you for my watching videos. If you like my videos, then like, share and subscribe it. Okay, thank you.